Hi, I'm Chris Duncan, independent insurance broker, and today's video is about Medicare Part C, also known as Medicare Advantage Plans. And before we get into the specifics of Medicare Advantage, I first want to mention there isn't anything wrong with Medicare Advantage Plans. We have many clients on Medicare Advantage Plans, and they're extremely happy with them. And the reason we mention it like that is there's a lot of videos out on the internet that are disparaging to Medicare Advantage Plans. But as long as you know the specific rules of your Medicare Advantage plan and how they work, it can be a very viable option to receive your Medicare. In addition, 34% of all Medicare beneficiaries are on a Medicare Advantage plan, and that equates out to more than 61 million people in the United States in 2018 have a Medicare Advantage plan. So a Medicare Advantage plan, it may be right for you, and it may not be. But we're here to explore all of the options so you can make the best decision for exactly what your needs are. Medicare Advantage is an all-in-one alternative to original Medicare. And these bundled plans, they include Medicare Part A, Part B, and many times they also include Medicare Part D, the prescription drug portion as well. And some Medicare Advantage plans also have lower out-of-pocket costs than original Medicare. And some plans also cover additional benefits that original Medicare doesn't, like vision, hearing, and dental. The types of Medicare Advantage plans are HMOs, PPOs, also PFFS, which stands for Private Fee for Service, special needs plans, usually for those with Medicare and Medicaid, chronic special needs plans. But this video is going to focus on the HMO and the PPOs because by far they are the most common. And first off, what is Medicare Advantage? And like we said, it is an alternative to original Medicare. And briefly, original Medicare is ran by the government, more specifically, the Centers for Medicare and Medicaid Services. And Medicare Advantage, now that's run by the private insurance companies. And because it's ran by private insurance companies, they have the option to offer extra benefits like dental, vision, and hearing. Sometimes they offer additional over-the-counter benefits that you generally get at a pharmacy, for example, like vitamins and adult incontinence products. And they may also offer rides to your doctors or your pharmacy as well. When I'm talking to my clients about Medicare Advantage plans and I list all of the positives, many times they ask, well, Chris, why wouldn't I get one of these Medicare Advantage plans? And before I let them choose a Medicare Advantage plan, I absolutely have to go through the negatives as well, because there are certainly a lot of them. And most of the Medicare Advantage plans are what is called an HMO, a health maintenance organization, meaning you have to go to the providers and the hospitals inside of a certain network. And if you happen to see a provider or a hospital outside of the network, unless you're having an emergency, then you're going to have absolutely no coverage whatsoever. So what happens is many times people who have a Medicare Advantage plan that don't understand them, they will get a referral from one of their friends. They'll say, hey, go see this doctor for this. And they'll go to that doctor. And when they go, they'll actually show their original Medicare card instead of their Medicare Advantage plan. And then that doctor will take their original Medicare information. And because they have Medicare Advantage, they no longer have original Medicare. And I'll explain a little bit more about that later. But they take out their original Medicare card and they give it to the doctor, and then they go. And they come home, and then a week or two later, they get a bill for the full cost of that doctor because that doctor doesn't accept Medicare Advantage. And because they have a Medicare Advantage, they no longer have original Medicare. So they submit the claim, the doctor submits the claim to original Medicare, and original Medicare says, hey, this person has a Medicare Advantage plan. They no longer have original Medicare. We're not going to pay you. So what that doctor ends up doing is they end up sending a bill to the person that saw them that had the Medicare Advantage plan for the full cost because they didn't have original Medicare. If you choose a Medicare Advantage HMO, you absolutely need to pick a primary care physician, and that physician is your gatekeeper. Because if you do need a referral to a specialist, in all likelihood, you will need to go see that primary care physician first in order to receive that referral inside of the network to make sure that you have coverage. Now, we mentioned PPOs, which are preferred provider organizations, and they have a much wider range of doctors that you can see. And the way they work is they have a network of doctors, and it's usually greater than an HMO, that you can go see, but you also have coverage outside of that network as well. However, the costs to you when you do see a provider that is outside of the network are usually much higher to the Medicare beneficiary that picks a Medicare Advantage PPO plan. So what they do is they raise the costs for you to go see a provider outside of the network, and that is a deterrent and to keep you outside of the network and to keep you inside of the network where the costs to the insurance company are going to be the lowest. Another disadvantage to the Medicare Advantage plans to keep in mind is doctors can come in and out of the network at any time. So for example, if you're seeing a primary care physician and they lose their contract with the health insurance company, or the specialist loses their contract with the health insurance company, or the doctor chooses not to take the program any longer and they leave, then you need to go ahead and change your doctor. And if you go back to that doctor, you're likely going to have absolutely no coverage whatsoever. So it's very important to know that the doctors do change quite frequently on these programs. The biggest difference, in my opinion, between original Medicare and the Medicare Advantage plans is with original Medicare, you have the option to go see any doctor, hospital, provider in the United States that accepts Medicare without any referrals. And with the HMO, like we mentioned, you must stay inside of that network. And if you go outside of it, more than likely you are not going to have any coverage whatsoever. And I find that as a disadvantage. But my clients that do have Medicare Advantage plans, we absolutely make sure that they understand this and that we've done the necessary research together to make sure that the Medicare Advantage plan is the exact correct fit for what their needs are. We mentioned many Medicare Advantage programs have a $0 premium or a low premium, but we want to reiterate that you always must pay your Part B of Medicare. That's $135.50 for most Medicare beneficiaries. But with that said, some programs that are available here in the United States, they will actually pay all or part of your Part B premium for you. For example, we have some clients on programs in the Los Angeles area that pay a portion of their Part B premium, and they're also out there in the Florida area as well. This next portion I read directly out of the Medicare and You handbook, and it states if you join a Medicare Advantage plan, you still have Medicare. Notice it doesn't say you still have original Medicare, but it says you still have Medicare, but you'll get your Medicare Part A hospital insurance and your Medicare Part B medical insurance coverage from the Medicare Advantage plan and not original Medicare. And then it says in most cases, you'll need to use healthcare providers who participate in the plan's network. I mention that because we just want everybody to be absolutely clear that when you choose a Medicare Advantage plan, you no longer have original Medicare. And like it states, you still have Medicare. They're not saying you don't have that, but you don't have original Medicare as the coverage. Remember, original Medicare comes and is delivered by the Center for Medicare and Medicaid Services, and Medicare Advantage, if you choose that route, is now through a private insurance company, and they make the decisions on what's covered and what's not covered, so on and so forth. Many times I'm asked, Chris, if there's no monthly premiums or they're low premiums, how can the private insurance companies deliver me insurance when they're getting very little money from me? And the way that works is original Medicare, also known as Center for Medicare and Medicaid Services, they pay a monthly premium to the insurance company that you choose on your behalf. And because they pay that money to the private insurance company, original Medicare no longer covers you. That's why I mentioned in a example before that if you have a Medicare Advantage plan and you try to go see a doctor that doesn't accept your Medicare Advantage plan, but they accept original Medicare, and you try to use your original Medicare card when you go see that doctor, original Medicare knows that they're paying a premium to the Medicare Advantage company that you've chosen, so they're no longer going to pay your claims and you don't have coverage under original Medicare any longer. Next, we're going to talk about when you can enroll into the Medicare Advantage plans, and we'll talk about it for people that are turning 65, as that is most of the people that are watching this video. And you have the birthday month that you turn 65, 3 months before that birthday, and then also 3 months after that birthday month as well. So for example, if you're turning 65, and let's say anywhere between September 2nd and September 30th, you know that your Medicare is going to go into effect September 1st. If you happen to have been born the first of the month, for example, September 1st, then your Medicare goes into effect a whole month early, which is August 1st. But for our example, we use someone who's turning 65 between September 2nd and September 30th. So their Medicare goes into effect September 1st. So they're going to have 3 months before that birthday month to go ahead and enroll in their Medicare Advantage plan. So that's going to be June, July, and August. And if you happen to enroll in June or July, it doesn't mean that your Medicare Advantage plan goes into effect early. It goes into effect September 1st. And you also have the choice to enroll during your birthday month, which is September in this case, and it will become effective on October 1st. And then you have 3 months after as well, which is going to be October, November, and December. And it's going to become effective the first of the month after that you enroll. So if you enroll in October 15th, then your Medicare Advantage plan in this example is going to become effective on November 1st. We do get quite a bit of phone calls and emails from people that are putting their Part B into place after they have turned 65. And usually it's because that they've gone ahead and lost their group coverage. And then that triggers what's called a special enrollment period. So let's say this person turned 65 3 years ago, and now it's 3 years later and it's April, and now they want to put their Part B into effect in April. And because of the special election period, they absolutely have an opportunity to go ahead and put a Medicare Advantage into place. However, there are some different rules. You do not get that 7-month window that you got when you turned 65. Instead, you absolutely have to put that Medicare Advantage plan in effect in the month that you end your group coverage. So, for example, if you lose your group coverage in March and you're putting your Medicare Part B in effect April 1st, then you need to enroll before April 1st into the Medicare Advantage plan for the April 1st effective date. We do get some phone calls from some folks, some emails, that in an example like this, their Part B went into effect in April, and for whatever reason, they didn't put a Medicare Advantage plan in place. They think they have this 7-month window, and then they go ahead and contact me in June or July after their April effective date, and they want to put that into effect. They're outside of that window, and we're not able to get them into a Medicare Advantage plan at that time. We have to wait for the annual enrollment period, which is what we'll talk about next. The annual enrollment period runs once a year between October 15th and December 7th. And this is the time of the year where you can make your changes, where anybody can enroll into a Medicare Advantage plan. Anybody can disenroll out of their Medicare Advantage plan during this time. This is when to make the decisions. It's also very important to note that if you're watching this video and you're thinking about getting a Medicare Supplement plan, that this Medicare annual enrollment period, the AEP as it's called, has nothing to do with switching your Medicare Supplement plans. The annual enrollment period only has to do with people that have Medicare Advantage and prescription drug plans. So for example, let's say you had original Medicare and a Medicare Supplement for 3 years, and now you'd like to try one of these Medicare Advantage plans. Well, this is the time where you could go ahead and enroll. So anywhere between October 15th and December 7th, you could contact us and we could enroll you into a Medicare Advantage plan that would become effective January 1st. Now, let's say you've had a Medicare Advantage plan for some time and you're saying, well, this isn't right for me. I'd like to disenroll and enroll back into original Medicare. This is the time, October 15th through December 7th. You contact us. We go ahead and we disenroll you out of the Medicare Advantage plan, doing it a couple of ways. One, contacting your Medicare Advantage plan and telling them to disenroll you entirely. Or you can enroll into a standalone prescription drug plan, and that will automatically disenroll you out of the Medicare Advantage plan. Or let's just say you want to change Medicare Advantage plans. You have Company A right now, and they had some increases or some doctors left, and you want to change to a different company, call it Company B, then we just go ahead and fill out the paperwork. It takes about 5 minutes. And send that into the Center for Medicare and Medicaid Services. They end up getting it, and they disenroll you automatically out of your old plan, and then they enroll you into your new plan as well. It's important to mention that Medicare Advantage is not available throughout the country. And because we do business throughout the United States, we know where all the companies are located and where all the plans are available, but they do not have to be available in all counties. And as a general rule of thumb, the Medicare Advantage plans, they are available by county. And in some certain specific instances, they are available as specific as down to specific zip codes. And in order to qualify for the Medicare Advantage plan, you have to have Parts A and B of Medicare. And you cannot have end-stage renal disease. Usually if you're on kidney dialysis, then you're not eligible to be on a Medicare Advantage plan. If you do happen to have kidney dialysis, there's actually a couple of programs out there that are called CSNP, which means Chronic Special Needs Plans, and they're designed specifically for people that are on kidney dialysis. So if that happens to be you or someone you know, give us a contact. Maybe we'll be able to find one of those programs in your area. But again, it's important to mention that you have to have both Parts A and B of Medicare and not have end-stage renal disease to be eligible for a Medicare Advantage plan. And it also has to be available in the county or zip code that you reside. We're going to talk about a specific rule to leave the Medicare Advantage plan for when you picked one up when you turned 65. This is only for those that have chosen to get a Medicare Advantage plan when they turned 65. Sometimes people get Medicare because of a disability and they're under age 65, let's say age 62, and they chose a Medicare Advantage plan. This rule does not apply to them. Only applies to those that are turning 65. So in this example, let's say you turned 65 in April, you chose a Medicare Advantage plan, and on down the road you decided, you know what, Chris, this isn't right for me. I don't want this Medicare Advantage plan. Because the federal government offers you a 12-month look at the Medicare Advantage plan, that means that you can leave at any time during those first 12 months and you can disenroll back into original Medicare very easily. It becomes effective the first of the next month that you decide to disenroll. So let's say you decide to disenroll October 7th, then it would become effective November 1st. And then it's also important to mention that if you would like to leave the Medicare Advantage plan during the first 12 months after you turn 65, you also get what's called a guarantee issue into a Medicare Supplement plan. So we can go ahead and disenroll you out of the Medicare Advantage plan and we can enroll you into a Medicare Supplement plan guaranteed issue, which means the insurance companies, they can't deny you. They absolutely have to accept you, and they must also accept all of your pre-existing conditions and start covering those from the first day that you have coverage with original Medicare and the Medicare Supplement plan. Now we're going to cover the rule to leave the Medicare Advantage plan if you enrolled into a Medicare Advantage plan for the first time and you had a Medicare Supplement plan. So let's use an example that you got a Medicare Supplement when you turned 65 and now you're age 68. And you would like to go ahead and try one of these Medicare Advantage plans. It's during the annual enrollment period, October 15th through December 7th. And we choose the Medicare Advantage plan that you'd like to have, and that becomes effective January 1st. Now, for the next year, between January and all the way through to December of that year, if at any time you do not like that Medicare Advantage plan or any reason that you deem, you can go ahead and leave that Medicare Advantage plan at any time, very easily. And then you can also return back to your Medicare Supplement plan, what's called guaranteed issue. Like I mentioned before, if you do that, then the insurance company can't ask you any medical questions. They absolutely have to allow you into the Medicare Supplement plan, and they also have to cover any pre-existing conditions that you may have as well. Many years ago, the federal government, Center for Medicare and Medicaid Services, they had what was called the Medicare Advantage Disenrollment period. And that went away, but it has come back, started again in 2019. And the Medicare Advantage Disenrollment period runs between January 1st and February 14th. And this is what you can do during that time. If you have a Medicare Advantage plan and you would like to switch to another Medicare Advantage plan, you can do so between January 1st and February 14th, and it becomes effective the first of the next month after you've made that decision and filled out the paperwork. Or during this disenrollment time, January 1st to February 14th, you want to leave and go back to original Medicare, they give you the opportunity. So during that time, you can disenroll out of your Medicare Advantage plan and return back to original Medicare, and you will do so effective the first of the next month. It's also important to note that if you use this disenrollment time to leave your Medicare Advantage plan, you do not have a guarantee issue into a Medicare Supplement program. You will have to answer the underwriting questions, and you will also have to medically qualify for it. Like we mentioned, most of the Medicare Advantage plans do cover prescription drugs. And each company has what's called a formulary, and all that is a fancy term for a list of covered drugs. And all the companies, they have a different formulary. So it's extremely important for us, for when you're looking at your Medicare Advantage plan, to first look at your prescription drugs. So what our clients do is they send us a list of their prescriptions, and then we check it with all of the Medicare Advantage programs that are available in their area to make sure that the company that they want will cover all of their prescriptions. Or we'll find a company that covers them at the best cost if they don't happen to cover all of the prescriptions. And last, I'd like to mention that you cannot have a Medicare Supplement and a Medicare Advantage plan at the same time. And the reason I mention this, I actually got a call on it yesterday from a client of mine. They were talking about their husband, and their husband was on a Medicare Advantage plan. They had picked the Medicare Advantage plan many years before they had come in contact with me. And the wife was saying that the husband was just diagnosed with cancer and was having to pay 20% of the chemotherapy bill, which was becoming quite high. And she wanted to know if she could purchase a Medicare Supplement plan like she had in order to cover what the Medicare Advantage plan didn't cover. And the answer is absolutely not. You cannot have both. Remember that original Medicare, the Medicare Supplement plan that you pick, supplements original Medicare, and the Medicare Advantage plan that you pick replaces original Medicare. So you can't have a supplement and also a Medicare Advantage plan at the same time. Although we do run into some people who call us and they tell us, the referrals usually, they're never any of our clients, but they tell us, Chris, I have a supplement and a Medicare Advantage plan. Well, if you send a claim to the Medicare Supplement company, they're not going to pay it. So you're just wasting your money right now. And we've actually helped a few people in the past go ahead and get refunds from their Medicare Supplement companies just by providing them the information that they had a Medicare Advantage plan during the time that they had this Medicare Supplement plan. The Medicare Supplement company, after a couple of weeks, refunded all of their premium because they weren't going to pay out anyway. So if you happen to have a Medicare Supplement and a Medicare Advantage plan, give us a call. We can help you get a refund if you're entitled to one for that. Again, my name is Chris Duncan, independent insurance broker. I run a company called Trusted Benefits Direct. And if there's anything that we can help you with, feel free to give us a call at 800-910-3382, or you can use the links to visit our website. And don't forget, if you like the information in this video, to go ahead and subscribe to our page. It's very easy to do in the bottom right-hand corner, so you're notified when we're putting out new videos and any other updates. Thanks again. I appreciate your time, and we'll be talking with you soon.